Alternative medicine is defined as a set of products, practices, and theories believed or perceived by their users to have the healing effects of medicine, but whose effectiveness has not been clearly established using scientific methods. Alternative medicine is usually based on religion, tradition, superstition, belief, and in supernatural energy. A warm welcome to the Alice Mackay Show, and today we're going to be talking about alternative medicine with our resident doctor, Vivek Solanki, and Dr. Sumaya Omar, a holistic doctor. Welcome to the show.
Thank you.
And Dr. Omar, what is a holistic doctor?
Okay, so a holistic doctor is pretty much a doctor, well, I'm kind of like a hybrid because on the one hand, I'm registered with the Medical Dental Council, but on the other hand, I use a lot of natural medicine in my practice. So when they say holistic, it doesn't just mean that a patient's coming to me at the end of their long journey with a whole list of things that they got to get through, but it means that I'm looking at the patient from all different dimensions. So you as a patient would come with an illness, but you're not just a body. You have a mind, you have a soul, you have a family, you've got a job, you've got a community, you also eat in a certain way, you exercise, you've got certain lifestyle behavior. So I'm going to take all of that and unpackage it and deconstruct it and say which part of you is causing this illness and how can we manage that.
So Doc, what is alternative medicine?
Alternative medicine is where it's not your mainstream healthcare, right? So mainstream healthcare came about in the last 120 years. Alternative healthcare has been in existence for the past many centuries, if not thousands of years. And it became alternative because science that took over religion and cultural issues. And science as well, whatever is not scientific is alternative. And that's alternative healthcare. Now that includes herbal therapy, it includes acupuncture, it includes Ayurveda, it includes Nanga therapies in Africa, and South American treatments. It involves a whole lot of other non-mainstream healthcare.
Well, and Dr. Omar, what is the difference between alternative medicine and the conventional medicine that we're used to?
Okay, so as Vivek said very eloquently, alternative medicine was in existence for centuries. So, if you even look at the last 6 to 8 centuries, in universities around the world, medical schools around the world, people were using the canon of medicine written by Ibn Sina. And only when germs were discovered, that's when it was kind of thrown out, and then research and development and lots of money made it, it made it alternative and not mainstream. So what it really means is everything that we would do to help to bring the patient back into balance again. So we're looking for the underlying cause of things, whereas when we look at the conventional medicine, it's looking at symptom relief. So if you've got a headache, or if you've got a fever, you're going to go and get Panado. That's the conventional treatment. But as alternative medicine, we're looking and saying, what is the root cause of this? And do we actually need to treat a fever? Is it good for us? Maybe it's a way of cleansing the body. Maybe it's the best way to fight germs. So it's trying to look at it, underlying causes of illnesses. That's pretty much the difference between the two.
And Dr. Omar, what is the regulation and licensing regarding alternative medicine in Zimbabwe?
Okay, so there are 2 different organizations. The most important one is the Traditional Medical Practitioners Council. And in Zimbabwe, we're very fortunate because the Ministry of Health have tried to include all the traditional healers because they understand the importance that they play in primary health care. So at the Ministry of Health offices, you can go up there and you can register. The important thing is to what they're trying to do is they want to ensure that the quality of care that the patient gets out there is of a suitable degree. They don't want people selling herbal medicines on the side of the road. They need your premises to be registered. They also want to ensure that the ingredients that you have in your herbal solution, it's labeled and that it is of a good and pure form.
Right, which is really good. Yeah. And Doc, how safe are these medicines?
Look, there is precautions that one has to take. If you overdo any medication or drugs or even food, it can be toxic, right? So we say, look, follow the advice that you're given by the herbal practitioner, and the dosage, follow the dosage, follow the route of treatment, whether it should be taken with food or without food, just like any other conventional medicine as well. And don't just gulp the whole packet down thinking that will maybe cure you faster.
Right. What are the different types of alternative medicines that are available in Zimbabwe?
Well, there's a lot. There's a lot. I mean, we are a cosmopolitan society, and we have access to all sorts of alternative healthcare. We're talking about Ayurvedic medication. We're talking about Chinese medicine. We're talking about acupuncture, acupressure, the Nangas, our traditional healers. We have the South American treatments. We have a whole range of alternative healthcare available, including chiropractitioners and herbalists who just purely practice herbal medication. So there's a wide variety.
I think the important thing also is to look at healing as a spectrum. On the one hand, you've got the massage therapists, crystal healers, the faith healers, the Nyangas, the herbal practitioners, and then on the other hand, on the other extreme, you'll get the surgeons. So everyone has a place in the sun. It's just about having a wise person to direct you into the right way, so that you do no harm, number one. Number two, you use the least modality for trying to affect the change, and then you ramp it up. And be sensible. If somebody comes to me and they've got a raging pneumonia or tonsillitis, I'm not going to give them a herb. They need an antibiotic, but it's about knowing when is the right time and the place to use a particular type of remedy.
Right, that brings me to complementary medication, or I call it complementary medicine. What is it?
Okay, so complementary medicine, as the word suggests, complements the mainstream. So if you, say for example, have a sciatic pain, you've got you sprained a nerve in your body. If you come to a conventional doctor, you might get some anti-inflammatories from there. You might get a gel or something to rub on.
You might get an injection also.
Yeah, exactly. So that's kind of. But if more often than not, doctors now recognize that there's a need to have further care or complementary medicine. So you would say, okay, you can go to an acupuncturist, or you might want to go to a chiropractor, and that will complement what I'm doing in my practice. So they work hand in glove, in a sense.
Well, isn't this the way we should be going?
Absolutely. I think the days of where alternative healthcare was pushed into the dark ages is out now. It's been joining the mainstream. I think the public out there are more aware of the benefits of alternative healthcare and herbal therapies and things like that. And then more and more challenge the practitioners, conventional medical practitioners, to say, look, should I not be trying other non-mainstream medications to minimize side effects and to have a better outcome? And in fact, I'll bring in the issue about antibiotic resistance. I think antibiotics have been overused and abused. And now we are at a situation where we are about 2 antibiotics away from not having any treatment for multi-drug resistant bacteria and tuberculosis.
That's really shocking.
Absolutely. And so I think this is where alternative healthcare comes in to alleviate such pressures in the healthcare system.
Right, and on that note, we take a break. And when we return, we're taking a look at the various types of alternative medicines and the health benefits of fasting. Stay tuned, we'll be right back.
And different faiths will fast in different ways, whether it be a 12-hour fast, sunrise to sunset. Sometimes people will fast 24 hours. The important thing is restricting your calories.
Welcome back. You're still watching the Alice Makhaya Show, and I'm still talking to our resident Dr. Vivek Solanki and Dr. Sumaya Hunga, and we're talking about alternative medicine. And in this segment, we're going to be taking a look at the health benefits of fasting and also looking at various alternative medicines. Welcome back. Right, so can you just tell us about the different alternative medicines that are used to cure ailments, such as the Ayurvedic?
Okay, so Ayurvedic medicine originated in India many centuries ago. The underlying philosophy is they look at the human body in terms of the temperament. So you could be wet, cold, hot and dry and thereof. So you will be able to look at a patient and diagnose them and prescribe a program depending on their different temperaments, whether they're too hot, whether they're too cold, whether they've got too much fluid, etc. So that's one of the modalities, you know, that's been around for centuries. Chinese traditional medicine is another one that's been around for a very long time, which is where we get the acupuncture treatment from. Cupping therapy also originates from there. And
also Chinese herbal therapies. No?
That's right.
Where they use a lot of different types of roots, mushrooms, tree barks, things like that. Yeah?
Moxibustion, they use, you know, that's right, and barks as well they would use. And then there's also Unani Tib, which is Arabic Greek medicine, which is where modern medicine originated from. So it was a system of medicine that originated in Greece, and that's where cupping actually originated from. And Galen and Hippocrates were the father of modern medicine, and this, like I said, was the type of medicine that was practiced in the world for centuries until the 19th century when we discovered microscopes and instruments.
What is cupping?
Cupping therapy is basically, it's the deepest tissue massage you can get. And it's cups very similar to these, where, you know, we apply it on different body parts, especially inflamed body parts, and we create a vacuum. And when we do that vacuum, we can also see a certain level of bruising. And when we see that, we will use a needle, similar to an acupuncture needle, but a bit thicker, and we pierce the skin and reapply the cups, and you actually bleed a bit into the cups. So what that really does, which is a similar principle to acupuncture, is it restores the energy. They call the energy qi in Chinese medicine, or prana in Ayurvedic medicine, or physis in Unani Tib. So basically, wherever there's an energy field that runs through your body, wherever there is a blockage of energy is where you will feel pain. So when you do the cupping therapy or acupuncture, you're restoring the energy flow through the body, and hence bringing about restoration of health.
So, Doc, how does acupuncture reduce pain?
Well, acupuncture, first of all, acts in the way that it controls your qi, right? As Sumaya said, there's a whole lot of nerves that flow through our bodies and things like that. And certain aspects where the pain or the problem area is, that the qi is blocked, right? So the acupuncture needle would go into that area, would be inserted there, then it releases the pressure or the flow.
Right, so when you say qi, what do you mean?
It's a flow of energy through the body.
Right, and just talk more, what is chiropractic?
Okay, so chiropractic, it's a kind of a manipulation of the body, but it's also based on the principle that you have a nervous system, and from your nervous system, originates all the nerves, the peripheral nerves, that will go to every single part of your body. So if there is a problem, let's say with asthma, and you've got a problem with your lungs, and you might inhale dust, or emotions might trigger off asthma, there is a theory that perhaps it's a specific part of your cervical spine that's involved with that. So if you had to realign or manipulate the spine, you would find that the asthma tends to get better. They also use chiropractic treatments very often and very successfully in colic patients, in colic babies. So, the whole theory is that as the baby comes to the birth canal, there might be a bit of manipulation in the cervical region. So if you go to a chiropractor, they realign it using, either finger pressure, or they've got a special type of a gun, and they realign it, and all of a sudden the spasm, because of that innervates your diaphragm, is released, so you don't produce that much acid any longer.
Okay.
So
yes. A lot of people use chiropractors for neck pains, back pains, and things like that. They manipulate them and they crack the bones around and things like that.
Mm-hmm.
So it's got a lot of use on the in joints and your spine.
But in some religions believe that faith and prayer can actually heal you or cure certain diseases. What is your take on that?
that's a very interesting point. I actually tried to do a bit of research with that, and I found on WebMed, which is a very reputable website. I use it all the time. Do you use it?
All the time.
And WebMD, exactly. And it states there that people that have a faith and pray will spend 3 times less duration after an operation in hospital. Also talks about how you recover after a heart attack, how the recovery period is much better. So I do think, I'm not really sure whether it's just the prayer, or it's also people that are church going, that have some kind of a network that supports them, and people that they know are praying for them. Does that create a better sort of emotional health in that type of a patient? I'm not really sure, but there is evidence that prove that that prayer does have an impact on positive outcomes.
And it's also a psychological effect, isn't it? It's like a placebo effect as well. If you believe in something, you have faith in it, you know you're going to cure yourself, whether it's through praying or through meditation or group therapies and things, putting all the energies together. I think it's your mindset that says, wow, this is all great and it's going to help me and it's going to cure me. You believe in yourself, you believe in that therapy, you believe in that prayer, you believe in that meditation, and it's going to have positive effects, I think, at the end of the day.
And I do think that all healing does come from God, if you're asking my opinion, that it does, but we are just His instruments, that He gifts us in different ways. Obviously, you need to be able to go and get the knowledge, and you need to be able to do the right thing for the patient, but ultimately all healing comes from God.
Yeah, and that brings me to fasting. What are the health benefits of fasting?
I love this topic. This is my pet topic. Yeah, and fasting is a very interesting phenomenon. I mean, it's obviously, we know that all the big faiths in the world advocate that. So, and different faiths will fast in different ways, whether it be a 12-hour fast, sunrise to sunset. Sometimes people will fast 24 hours. The important thing is restricting your calories and just doing it, and stop eating. Give your body a chance to be able to go into healing and repair. So, the first thing we notice with fasting is that your cholesterol levels can change. You can reverse insulin resistance with fasting. Your blood pressure can go down. We also have this concept of what we call autophagy, which is basically how do you get rid of dead and cancerous cells, because most of us believe that we all have a certain amount of cancer cells. Mutations are happening all the time. If you fast, your body goes into eating up all those bad cells as well. So, the whole concept of fasting, one can look at it. We also talk about things like intermittent fasting. And what is that people say, that one should eat breakfast as a...
Eat breakfast as a king, lunch as a prince, and dinner as a pauper.
Yeah. And I'm sorry to say, we're kind of throwing that whole, rationale out the door, because now we're saying, don't eat breakfast. Eat your first meal at lunch and have an early dinner. So you're pretty much eating at noon, eating at 6 p.m. So from 6 p.m., you're not eating anything. Hopefully you're not having midnight snacks, and you're not having any breakfast. So you're having 18 hours of no eating. So your body then goes into healing and repair to be able to heal the body. So, and it's one of the only ways that can actually reverse the hands of time. So, and it's been proven. We look at something that we measure when we're looking at biological age is what we call the telomere lengths, which is really, the chromosomes have got 2 bottom legs, and if you measure the lengths of that, the longer they are, the longer you will live and the healthier you are. So it's been proven that by fasting you can actually elongate those legs.
But of course one has to be careful when in this type of diet and that, it's not good for diabetics and hypertensive, people with kidney problems and things like that as well. There's something that we have to be aware of, right?
Can I just recap? So you're saying that if you fast more often, you're definitely going to live longer, and you'll look younger as well.
That's right.
Exactly. And on that note, we take a break. And when we return, we'll be talking about herbal medicines. Stay tuned, we'll be right back.
People take soursop extract as well, or soursop tea. A lot of people also take marijuana. It relaxes them.
Welcome back. You're still watching the Alice Mackay Show. I'm still talking to Dr. Vivek Solanki and Dr. Sumaira Omar, and we're still on the subject of alternative medicine. And in this segment, we're going to be taking a look at herbal medicines. Welcome back. Why is it that herbal medicines are the most commercially successful branches of alternative medicine?
That's a good question. I think it also goes back to our original discussion about that, about herbal medicines being the predominant type of medicine that was available for all the years previous to modern medicine emerging. And in fact, where did modern medicine come from? I mean, you look at things like aspirin, simple aspirin. The root of aspirin is salicylic acid. Where did that come from? It's from the bark of a willow tree. So the bark, if you take the bark of a willow tree and crush it up, and this is what South American Indians did, when they were going out and fighting, that is an analgesic and it's an antipyretic, meaning it helps you with pain and it helps you with bringing down your fevers. So if you give it to someone, it's a perfect medication But if you give them aspirin and too much of it, you're going to ruin the stomach lining because you've isolated one bit of it. So I would say that herbal medicine is as popular as it is and is so widespread because that's where our modern medicine is arrived from. Things like, digitalis and digoxin, which is medication that we use for the heart, comes from a flower, comes from a plant. Opium, is all the opiate medication, pain relief comes from a plant. So herbal medication already had a predominance in the world all around us. So I would just say that now we know because the pendulum is swaying in the other direction, companies have caught on to that. People are asking for herbal medication. So as a result, we find that a lot of research and development is going into that. A lot of money is going into that. So it's become very popular once again.
Right, and Doc, can you give us some examples of herbs that are derived from plant and animal products?
Yes, I mean, there are numerous. I mean, there are spices, there's herbs, there's fruits. I'll give you an example of a fruit. It's a mangosteen. It's an Asian fruit, which is highly advocated for patients who are suffering from cancer or even prevention of cancer. In fact, we have a patient currently in Denmark who takes 2 bottles of this every day and he's under chemotherapy. And I tell you the side effects and everything else and minimalized from taking this mangosteen extract. People take soursop extract as well, or soursop tea. A lot of people also take marijuana to alleviate the disorder or the nausea and vomiting. It relaxes them. It's also, besides being an antiemetic, it's also anti-cancer medication. Of course, one has to be careful what extract of the marijuana that we use. You can't just go around smoking it and thinking that you're going to be healed. But actually, there are the oils that are extracted. And they're actually
it's a proper protocol. And I think it's interesting that you talk about the mangosteen. And I'm sure you're alluding to the fact that mangosteen is so high in its vitamin C content. And we know now that vitamin C is potent for fighting against cancer cells. Cancer cells hate vitamin C, they also don't like oxygen, and they love sugars. And I think the last show you had was about sugars being poison, and that's one of the areas where it works, is it feeds cancer cells. So you want to starve the cancer cells off sugars. You want to give them less. You want to give them lots of oxygen, and you want to give them lots of vitamin C. And just looking at our own backyard, I mean, how blessed are we to live in Zimbabwe at this moment in time? I mean, our humble little baobab plant produces the highest concentration of vitamin C of any living organism comes from baobab. So, if you wanted to be healthy and just do something to keep yourself healthy for as long as you can, take a teaspoon of that, moringa leaf. It's being used all around the world. Put a teaspoon of that, make yourself a little mixture with a bit of honey and turmeric, and there you go, you've got a health elixir.
You've got turmeric as well, right? You mentioned turmeric. Turmeric we're using for people is an anti-inflammatory, it's antibacterial, right? It helps with inflammation, with the UTIs, it helps with your arthritis, it helps you to detoxify your liver, cleanse your kidneys. It helps you to control your diabetes, your high blood pressure. I mean, it's got multifactorial, and it's a root.
Right. And which part of the banana tree do you take in?
The powder of the fruit, that's what it is. So it's got that little bit of a citric acid taste to it, naturally, because of all the vitamin C content. When they look at different vitamin C's in fruits, kiwi is considered to be one of the top, but it's 10 times less of vitamin C content than baobab.
And Doc, you spoke about marijuana. Is marijuana legal in Zimbabwe?
No, it's not. So I don't say that you must take it. However, all over the world, marijuana is an accepted form of therapy. We use it as an antiemetic for cancer patients, for stress relief and things like that. Many states in the USA have decriminalized it. In Europe, there are many countries that accept it. And worldwide, I think there is use of extracts of marijuana, the tinctures, the oils, because you can't just go puffing around and think that it's going to cure you. No, it doesn't. In fact, you might actually have smoke inhalation issues as you have with cigarettes. But the tinctures and oils of the marijuana are used for therapeutic use. And marijuana is not just available for centuries in Africa, but it's a mainstream of cultures in Asia, in South America, in the Middle East. It's been part of therapy and treatment for centuries. Yes.
All right. And now let's look at herbal teas, because people are really big on herbal teas. Are they good? How good are they, or how effective are they as far as detoxifying the body?
herbal tea is an excellent way to be able to detoxify. So there are many uses. First of all, well, some of the teas that you can use for relaxation, like lavender tea, chamomile tea, if you're just feeling a little bit stressed, that's something wonderful to be able to help the mind relax. But if you're looking at detoxing the colon, things like senna, as a tea. We also use dandelion and milk thistle teas for the liver as well, because you need to detoxify the gut and the colon and the liver, because both of those organs will create so many illnesses. Vivek, I'm sure you see that in your practice too. Things like eczema or other illnesses all stem from the gut. So if you're looking at detoxifying, taking herbal teas, like I said, senna is a very good one. Psyllium husks, if you add that into your tea as well, will also do the same thing. The kidneys, if we need to detoxify that, we would use things like chicory or dandelion as well, the root of it as a detox tea.
And also, we got the green teas, we got the root teas as well, and herbal teas like, rooibos tea, and the root teas like the turmeric teas and things like that, ginger tea, all this, and mint teas. These are all very good for detoxifying your system and helping you to alleviate and cure or even prevent a lot of complications or inflammation-related illnesses, and that is your eczemas, your SLEs, your autoimmune disorders and things like that. It starts in the gut. So if we prevent it, keep it refreshed, eat correctly, I think it helps quite a bit.
And Doc, there's a lot of people who drink coffee. Are there any health benefits in drinking coffee?
Oh, it's absolutely. In fact, traditionally, coffee started from Ethiopia, right? I mean, it was drunk in Ethiopia as a therapeutic means, right? For digestion, for detoxification, for mood alleviation, depression, and things like that. However, the coffee we're talking about is in the pure form, not the chicory mix, instant coffee or anything like that. No sugar added and no milk added to it. And in the right doses, if you have 3 cups of coffee like that, black coffee, what we call, is actually therapeutic. In the Middle East, actually, it's a way of life. They call it kawa, and it is drunk very frequently, and it's very healthy.
And in addition, we find that if we're doing a detox on a patient, we use coffee as an enema, and it basically what it does is it goes into the liver and it helps to detox there as well. So from both ends, I guess it's beneficial.
Right. So both teas and coffees are beneficial, but obviously in the right quantity.
That's right.
And Dr. Amar, your last advice regarding alternative medicine.
My advice to the people out there is be careful. Don't approach any charlatan. There are lots of people out there that are willing to sell you snake oil, especially when you're desperate. You can be fodder for people that are out there to prey on you. So look for a reputable person, like Vivek said, seek the right advice. But herbal medicine has got so many benefits for us. 90% of the patients I see in my practice can be treated with herbal medicine. The last 10%, yes, we can script or refer. But 90% of ailments can be sorted through herbal medicine. So if you find somebody that's reputable and you can see that the ingredients are listed on the box, so you're not taking something that's going to mess up your kidneys or your liver, then it's safe enough to take.
The important thing here, I think, is we must understand that herbal treatment, we are not saying it's replacing your mainstream healthcare, right? There are surgical conditions, there's some other illnesses, high blood pressure, diabetes, and things that the herbal medication cannot cure. We are saying this is working in complement with your mainstream Western type of medicine.
And thank you for coming on to the Alice McKay Show. And then I was talking to our resident doctor, Vivek Solanki, and Dr. Sumaya Omar about alternative medicine. And as you heard for yourself, do seek the right advisor for correct therapy and also seek a reputable practitioner. And if you have any questions, do get in touch with us. The contact details are on the screen. Well, thank you for watching and